So thank you everyone for joining me for our important discussion. As everyone on this Zoom realizes, we've had a really disproportionate impact from COVID on our Black community and our communities of color. We first saw this really early on here in the 11th district, especially in some of our Hispanic communities, and then began talking about what was going on across the state and some of our Black communities. And it's really been striking. So I'm so grateful to have this impressive group assembled to provide a broad range of perspectives to kind of provide the whole picture on healthcare, mental health, pastoral care, small business education, and I'm sure others that I'm not even thinking of. And next we have Ms. Sanderson Wilson. It was great to see the work of Empower the Village when I visited the testing site in Morristown. Can you give everyone a brief introduction to it?
Sure, absolutely. So good morning, everyone. Thank you for having me participate. I know many of these wonderful faces here, and they're all doing great work, and we've been collaborating with them. So Empower the Village was founded in 2018. We are here focused on Black people and helping them realize their full potential, whether they're individuals, businesses, or community organizations and churches. So what Mikey's referring to is this summer, starting in June, we organized mobile testing for folks to know their status, whether or not they had the disease so they can keep themselves and family members safe. We partnered with folks on this call. So you'll see Pastor Carter from Calvary Baptist Church and Pastor Williams. They all sent out information and we rallied the community, the Black and Brown community, primarily in Morristown. And we've had over 1,000 people who came through when we were doing the testing to make sure that people knew their status. It was really important to me personally and important to me generally. So I lost my grandmother in April to COVID-19. And that, you know, like many things, will motivate you to focus on what's more important, which is keeping people that you love alive and healthy. And so we did launch the testing there. But from a broader standpoint, Empower the Village has been focused primarily on, I guess, all of the issues that are affecting the Black community, not just the health status, but also Black businesses. If you look at the statistics, 41% of Black businesses either temporarily or permanently closed their doors during this pandemic. And we're working very hard with an initiative called Make Every Friday Black Friday to encourage people at least once a week. 1 out of 7 Americans is Black. 1 out of 7 days, we're asking you to focus on Black business. We need that money to create jobs, to spur the economy. So it's critically important that we take care of our health and our wealth while we're going through this. And we have other programs to help students who need that extra enrichment. This virtual learning has been a challenge. So they're going to need some extra enrichment. They can't afford it. We're trying to provide free tutoring for that. But long story short, I will get off my soapbox. We have plenty of time to chat. But we are now partnering with Atlantic Health, getting the word out about how to get vaccinated. While this was going on, I was registering someone in Essex County to get vaccine. She's 89 years old and she's been struggling to get an appointment. So I'm looking forward to this conversation. Thank you.
Well, thank you. Please stay on your soapbox. That's what we're here to talk about. So I really appreciate it.
There's a lot of earned mistrust between the African American, Hispanic, and American Indian communities due to a longstanding history of issues with research and just harm from the medical community. And so while we're trying to fight this virus, we also have to fight against that mistrust. And so that means we partner with community organizations. That means we offer access, an opportunity to get the vaccine if people want the vaccine, but we also give people or respect people's autonomy in making that choice. We certainly hope that people will get the vaccine, and particularly in these communities, to help protect ourselves. But we also, provide information so that people have the information to make a decision on their own and respect their decision, whether or not they want the vaccine. So it's been a complicated almost a year of helping people in our communities. But what we're hoping is that by providing access and both in patient care, preventive care, and of the vaccine, that we could start the healing process.
I look at the numbers, just about every day, but I also see the people who are coming and who are getting vaccinated. And the African Americans are not represented. So we're trying with Faith and Prevention to go into the community to talk to people about why they need to be vaccinated. We all know stories because we've lost so many people in Passaic County to COVID-19, 1476. But the majority of the people who we've lost are African American and Latino. And so we are very, very concerned about it. We're doing what we can. As you know, our deliverable was to provide the ability to do online registration. That was a deliverable. But we also do in-person registration. We're also sending health educators into the community to talk to people, to let them know that this is not targeting our population. This is saying that here we have what amounts to almost a magic pill to protect you, and everyone is using it. So why don't we see if maybe this time we can trust the government to protect us? Why don't we give it another shot this time and see what's going on? Because we are disproportionately affected by it. So these are some of the things that we're doing in the community to help rebuild trust.
So Congresswoman Sherrill, if I can just jump in here, I just want to piggyback on the great, what was just shared, because what you said was wonderful about the fact that you're looking at the numbers. So we are data driven and we're doing exactly the same thing, looking at the numbers. And while I agree wholeheartedly with the education that needs to happen and bring people along to want the vaccine, and we're all doing that with different, in different ways, there are a large number of Black people who do want the vaccine. And I don't want us to spend all of our time lamenting what we know to be the history and we have to bring people along. We absolutely have to. But what we need is to lead by example. So if all of those who want the vaccine could get it, which is a big problem, they would be the example for the people in their families when they don't grow an extra leg, right? They survive. We need to get it moving when it comes to bringing the vaccine to where the people are. So the data that everyone has, we know where Black folks are, right? We have 14 out of 21 counties that account for 91% of Black people in New Jersey. Essex County is the largest county where Black people are. There are over 330,000 Black people in Essex County. That represents 25% of all the Black folks in New Jersey. Passaic County, I'll jump to that, has 75,000 Black people there. And it's about she said about 5%, 5.6% in Passaic County of the state. Black folks live there. And then there's Morris County, we have about 20,000. Now, 75% of those folks are 18 and over. So they're eligible, by that standard, other standards maybe not, but they're eligible for the vaccine and they want it. So we've been spending a lot of time working with Atlantic Health, Zufall Health, and others, trying to help people navigate to get an appointment. That's the hardest part for those who want it. And we've got to get the supply where the people are, and we need to help them get an appointment. I spent this morning, starting at 6 a.m. online, trying to get an appointment for an 89-year-old woman in Essex County who has a lot of multiple health issues. And so I walked her through it. She has an appointment now for Saturday. But the point is that we got to make sure the federal government knows, Congresswoman Sherrill, that there are plenty of Black folks that want this vaccine. And don't spend all the money on education. We got to do that, but we've got to get it to where they are, and we need to make sure they can get an appointment, right? And so phone calls are important to arrange them, not just online, because I can navigate online, not everyone can. But there are enough community organizations and churches that have people that can hold folks' hands if they know where to go and click the buttons for them. They can do that with them. So that is a bigger issue for me right now, because I feel like once your cousin and your uncle and everyone else gets it, then we'll get more people who want to get it. So it's a matter of bringing the mobile opportunities, if there are some, for vaccination to those communities, but also just getting them an appointment.
My concern is that as the curve goes down, as more people get vaccinated, I just think we lose sight of the fact that this was a crisis. And we have so many people that have been hurt by this. So if you look at the educational piece of it, we have kids that lost a full year of education, 1 full year. And so within Montclair, where we have an achievement gap, we now have an achievement crater per se. And so, my concern is that we as leaders, we have to clearly understand that the work is not stopping soon as the curve goes down. We have mental health issues that we have to address. When the courts open up and people can be evicted, that is another pandemic. That is going to be a crisis. So you're doing a great job, Congresswoman, but Congress has to release some funding and get involved in this whole price, things, because I just think our mentality is that once we see the curve go down, we think everything's okay and let's go back to normal. Well, we'll never be back to normal, ever. So let's stop thinking about going back to normal. Let's create what the new norm is going to be. And let's collectively, as leaders, decide what we're going to do to attack this point going forward.
My students are dealing with mental health issues. Just in general, Black people in mental health, they have the stigma of seeking help has historically been there. We're seeing now that is decreasing, and I know I feel like I'm on a big soapbox here talking, but we're seeing now 4 out of 10 young adults that are saying that they're dealing with stress and anxiety, and my kids are just not showing up. I was on the phone last night with a mother dealing with her son who is a senior that has not been showing up for classes because he does not do the online piece. And I know my community, we need to get the teachers back in, we need to get the students back in. And honestly, I can't understand how the teachers are not on the first list of the priorities. If we want to open up jobs, open up communities, and you want your kids to be back in school, they should be number one. I love the elderly, I'm in that group right now. But teachers, we need to get them vaccinated just for their own peace of mind. Having been that teacher in that classroom to say that I'm here and I'm protected. I could go on and on that, but I just want to share that little piece in regards to the whole testing.
I can't tell you all enough how rewarding it is to hear you all share your perspectives, because this is really what we are seeing at the community college level. We are seeing students who are truly struggling, and it really is all about the mental health and the economic health that they are really struggling with. Students don't have the money any longer to pay for books, to pay for lab equipment, to pay for whatever learning materials they need, because their families are in such dire straits economically. And even in Morris County, where folks think that we're a wealthy community, our families are struggling significantly.
On the education front, we talk about summer slide. This is the COVID slide of a lifetime that's happening right now. So anything that we can do in terms of getting funding for enrichment over this summer, one-on-one tutoring for Black and Brown families, that needs to be done. Many of the other folks who have means, even Black folks with means and other people with means, we're gonna buy our way out of this COVID slide. We're gonna pay for tutors. We're gonna pay for extra enrichment. A lot of folks can't do that. And so, one of the programs that I mentioned at the top, Village Drivers, is a program where we're trying to provide free tutoring enrichment, one-on-one where we can do it, virtually, wonderful, we can do that too, but it has to happen, because otherwise that gap, as was stated earlier, is just going to get wider and wider. So that's where we need the support.
Those in Essex, I don't know if you're aware, but they did just start a program, the county, where they're going to be having transportation for seniors to the Essex sites. So they're transporting 300 seniors a week. It just started, and there's a sign up for that. So for those in your communities and the churches who don't have transportation, I can work with you to get the number for that, so that you can get people signed up to get transportation help from the county to those sites so that they can get vaccinated. And I know they're making a plan, hopefully, once the J&J vaccine gets approved, to hopefully get to the homebound communities and more of those people who can't really get to the sites at all.
So I think the Congresswoman made the point that we have some great wins in pockets, but for whatever reason, those lessons and those opportunities are not being shared equally across. So wonderful, the great news that that's happening in one county, but it's not happening everywhere it needs to happen. And so we need to make sure that we're documenting what the best practices are and implementing them across the board. we know where the Black and brown community is. So if you give us the test, you give us the vaccine and the money where we need it, we will get it done, right? We can get it done. We just need to get the access to the transportation, to the test, to the vaccine. We can organize ourselves. You've got great folks on this panel, and I'm sure that many others are not here right now. We can get it done. We just need you to get it to us, meaning the money, the test, and the vaccine, and we will get it done. And the good news is there's not that many of us. This should not be this hard. There are about 20,000 Black people in Morris County. Only 75% of them are eligible based on age. We could get this done. There's enough vaccine to vaccinate all the Black folks who want it in Morris County tomorrow. In Essex County, just do the numbers, right? It's 330,000 Black people in Essex County. There are 75% of them that are eligible based on age. Not all of them want it. We can get this done. We just need to target and get access. We will get it done. And once I said, I said, and others said too, we just need more people getting it, and that will promote others who are reluctant to get it as well. So I think it's great that we've identified the issues, but it's now time to move to the solutions. And so, I'm all about that. People on here who know me know that. So anything I can do, Empower the Village can do, please reach out to us as you have now, Kelly and and team. We are anxious to work with you.